Good morning. My name is Carol Howe. I'm an assistant professor in nursing at Texas Christian University. I first became involved in health literacy when I was a clinician. I was a clinical nurse specialist and a diabetes educator, working with children and families living with diabetes. And I was the director of patient and family education for the Diabetes Center at the Children's Hospital of Philadelphia. So this began in the early 2000s, and I was aware that we weren't effectively teaching patients, children, and families the way we wanted to, and so I started reading a lot about best practices, evidence-based practices for diabetes education, and I came across the work of all the health literacy gurus that we know today, and became very involved with that, first as a lone person advocating that we take health literacy into consideration, and then bringing along my colleagues, dietitians, other nurse practitioners, physicians, and we created a program that was more health literate sensitive. At that point, we applied for a Pfizer grant, and we got funding to redo our materials for children with type 2 diabetes. Now, fast forward 7 years, I relocated to Texas, and I got a PhD in nursing and did my dissertation research on health literacy and communication about diabetes educators, parents' perception of them. And from those findings, I became an advocate for what families with low health literacy versus families with adequate health literacy, what they really need from us as diabetes educators. And I've continued to do that work in my research, really looking at how we present information, how we make it patient-centered, how we think about how we teach families. My whole work is both in my research and in my clinical work is to bring health literacy principles, clear communication strategies, those principles into my work, to advocate for patients, to work beside patients and families, as well as to work beside students as they learn to work with families.